And now the federal government, through the Ministry of Health and Social Welfare, has called for implementation of Nigeria's national food safety policy across all states to ensure the safety of the food supply. The Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, gave the directive during this year's commemoration of World Food Safety Day Symposium with the theme, Food Safety, Prepare for the Unexpected. Here's the rest of the story.
World Food Safety Day is commemorated annually to draw attention and inspire action to help prevent, detect, and manage foodborne illness risks. They say the quality of food determines how safe the food is to humans. At the commemoration of this year's World Food Safety Day, the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, stressed the need to uphold global best practices in food safety preparedness and food security for the future. The minister, represented by the Permanent Secretary of the Ministry, Daju Kacholam, also inaugurated the National Food Safety Management Committee for guiding resources to enforce the policy nationwide.
The policy propels us towards a future where the food we consume is not only safe, but essentially healthy. It lays out strategic plans to reduce the intake of salt, trans fatty acids, sugar, and alcohol, amongst others. By ensuring that our diets are healthful, we aim to alleviate the growing burden of non-communicable diseases that affect our country. However, the implementation of this policy is not a solitary journey. It demands the concerted efforts of all parties at both national and subnational levels. As part of the implementation of this policy, I have also, that is the coordinating minister, approved the establishment of 4 technical working groups that will serve as a conduit for improving the capacity of all stakeholders across the food supply chain.
The WHO country representative to Nigeria, Dr. Walter Kazadi Mulombo, represented by Pinda Wakawa, underscored the pervasive nature of foodborne diseases, citing them as a global health concern impacting 1 in 10 individuals worldwide.
Globalization has led to a growing interconnection of food supply chains, thus increasing the risks that unhealthy foods pose and can quickly escalate from a local problem to an emergency at an international level. To be prepared for the incidents that affect food safety, we therefore urge on the government to ensure safe and nutritious food for all by committing to development and update of national intervention plans for food emergencies, food control system, and foodborne disease surveillance. We also call on food producers to adopt good and safe agricultural practices, and we call on vendors and food business operators to ensure that food is kept and delivered safe.
Other representatives from the Ministry of Agriculture, Environment, Trade and Investment lauded the initiative, citing need for more interagencies collaboration.
Our behavior, the way we build food systems, and how we organize food supply chain can prevent infections and toxic hazards, microbial pathogens, bacterial, viruses, and parasites, chemical residues, biotoxins, and other noxious or dangerous substances from getting into our kitchen utensils. Food system policymakers, practitioners, and investors should reorient their activities to increase the sustainable production and consumption of safe food in order to improve health outcomes.
Animal and Animal Husbandry Services, who is also on top of their game in the area of preventing any detrimental practices in our abattoirs and in our marketing of different kinds of animal products. And in the crop sector, we are not also left behind. We are on top of our game about mycotoxin contamination, about the appropriate use of chemicals right from the get-go when we are planting in our agronomic practices, to make sure that whatever the agri sector is bringing out, agri-food system is bringing out for us, is actually safe for human consumption.
The World Health Organization indicated that nearly 600 million individuals fall ill and 420,000 succumb to foodborne diseases annually. The need to uphold food safety standards throughout the supply chain from farm to table was emphasized as means in reducing this burden.